Hi. I think we're going to start the next section, the whiteboard brainstorming session. And here we have a few representatives from the earlier talks. And we have a few questions that listed in the session. I think some of the questions, to me, still maybe not yet answered. To me. So I guess let me open one of the first questions that I would like, to have some ideas from the speakers and moderators, to see what they, their thoughts on that. So one of the first questions that that we have, what are the limitations of the current classification system? And we can go through, starting from Kristen, since you closest. So are they good enough? Are they be able to track it? To me, rapidly evolving viruses. To me, associate with phenotypic, changes. To me, Kristen, you can start off, and then go through, the limitations. The question.
Yeah. So.
To me,
I think especially if you're talking about pandemics or outbreaks, I think a system like Pango is very useful for that. I think because it's in my opinion, it's not so great for somebody who is maybe interested in really long-term evolution of a virus, over hundreds of years, but for a rapid outbreak, I think it's pretty useful.
To me,
I wish it were easier. Of course, you can always, for my own purposes, I kind of.
To me,
I know you try to make the names shorter. That's why you replace the super long 11111 with D or something like that. But
to me.
Then if you want to kind of, you want to go back and see it, see the whole thing. You have to go a mapping table, and then you can map B1 to something really long. So. And I also think the combination of having maybe people might disagree with me, but I think it's also useful to have, as we have now for the SARS-2, we have two systems in a way. We have actually have more than two, but I'm using two. One of them is the WHO, the omics, the Greek letter ones, which is kind of gives you a broad overview, and then you have at the same time you have the very detailed Pango.
To me,
lineage one. So I think this combination is not bad, I would say.
To me.
And the next question was.
It's okay. Maybe you can ask
the phenotype. Yeah, I don't think I'm qualified to answer that question. Yeah.
To me, any thoughts on the limitation of the current?
I can only speak to what I see coming into the NCBI taxonomy database. People submit, we rely a lot on the VMR, the virus names that are on VMR. A challenge for us is lack of complexity in the virus names.
To me.
Also duplications between names. So it's a challenge when people use the same name twice for different things. Also when the virus and the species names are the same. So Elliot knows about that. We've had discussions with him. So that is a challenge going forward, is specific names below species that we can annotate in the NCBI taxonomy, and thinking about making it unique enough to make it functional.
To me.
Can I ask a quick question on that point? Maybe it's worth saying that, or describing what the NCBI taxonomy database is. It's a database of names rather than unique identifiers others might pick up.
So I'm speaking only for names, right? So we don't look at the sequences, we look at the name.
To me.
Classification that the ICTV provides.
To me.
Consume the VMR when it comes out and try and adapt what we have to the ICTV accepted classification. But of course, we see a lot of things outside of that people use when they submit names.
Yeah, and I can comment on that a bit. This is Elliot. So one, there have been in the past, and Peter Simmons certainly mentioned this, where you have names that were equivalent between viral species and the viruses themselves. But with the advent of the binomial nomenclature, one of the key reasons for that is now to better distinguish all viral taxon names, especially species names, from the names of the viruses. And that transition from the old style names to the binomial names will be almost complete with the release of the new taxonomy on April 25th. And so I think at least in terms of equating a species name with a virus name, that problem itself will be mostly fixed. There's the other level below that. And yes, the exemplar gives you a virus name, a virus accession number that you can now use as the exemplar for the species. And sometimes the names of those viruses are the same as either other viruses in GenBank, perhaps potentially, I don't know if this is the case though, other viruses in the VMR. That would only occur when we have what we call additional isolates that are mentioned in addition to the exemplar. These are other isolates that are important from the standpoint of that species beyond just a single exemplar. And there may be cases where those virus names are the same or at least equivalent. We have no control over virus names, as I tell NCBI. And so virus names are determined by the person who submits the sequences, and those become fixed in the GenBank record. As we know, as Anita reminds us, that's an archival record and doesn't change. And we'll pull the virus name from those records. We can use aliases, and I think NCBI, maybe that's the direction you are going to make these names unique by creating an alias that you can use for the taxonomic record. And that's probably the best way to fix this in terms of the problems that you have. And so, it is by working together, groups like the ICTV and the NCBI, to recognize problems that aren't necessarily under the purview of the other organization, but when the other organization can help fix it, then certainly we're happy to do so. But there always are limits.
Yes. Okay. Ryan?
Just for Christian's response to the question, I don't know if it's, I think it's a tool Cornelius made, but maybe it's someone else. I can't remember. But there's a tool called Aliasor, which is like programmatic mapping between like expanded and short Pango lineages. And I do think, I don't know why anyone would have think you needed that when Pango was first started, but given how much it blew up, I would say sort of in hindsight, having some programmatic way to traverse, because it's essentially like a taxonomic system. So you want an API to interact with NCBI taxonomy. You want, for any of these subspecies classification systems, a way to programmatically.
It's a simple computational problem. It's just a mapping from.
Yeah.
But one more comment that I kind of would like to make is, because I said that, I thought the combination of the Omicron names, the Greek names, and the Pango lineages was kind of useful, but I think in a way they could actually be combined. Really, it may be simply that, because when you're replacing the long names with the shorter ones, you trimmed off everything at the beginning and replaced it by something. And if you kind of retain the first letter always, then you would still give you a kind of a broad. You would still know, I'm not saying it would work with the current system, but in the future, if you design another one, if you specifically make so that the first letter is let's say it's an A, and that one will always, you have A, B, C types, and then you have a long string of other stuff. And then when you make shorter names, you still remain the A at the beginning. So then that information is still retaining. Then you can, everything A's, you still know this belongs to the A group and B to the B group. But if you trim off the stuff at the beginning, then all that information is lost, and you need a mapping table to get it back.
Go ahead, Rodney, and then I'm going to have.
But is a mapping table a bad thing? I kind of didn't want to get into this, but it seems to me if you have a dynamic system where the IDs are dynamically changing in ways that, in order to support that system, you need a database essentially that maps that dynamic system. And it maybe gets into the use cases for these low-level assignments versus use cases for higher-level assignments. I think the nomenclature we were using the other day, addresses versus neighborhoods. But I think, Google Maps does a great job of figuring out where an address is, right? And I think, maybe that comes with any dynamic system that's a solution in this space. That is, those two things have to exist. If you have this low-level, very high, fine detail demarcation that's dynamic, there has to be a corresponding way of mapping that for the end user to understand the relationships in that space.
So, Angie just get here, because we were mentioning Pango as, like a system that can be used for outbreaks. And the questions that we heard, are there any limitation? What are the limitation of the current classification system, such as Pango? And is that system able to track, evolving virus rapidly? Can it, associate with phenotypic change and so on? And what's your thought on that? And then we can go to Cornelia next.
Thank you. Well, I may be biased, but I think Pango has worked great. I think it can respond reasonably rapidly as long as it's maintained. As long as we have Cornelius's hard work doing the designations and so many volunteers scanning for the scary spike mutations and growing branches. As far as I can tell, it has worked out well.
Thanks. Oh, Richard? Yeah, let's see.
Could I maybe give a counterpoint?
Yeah, yes, please. Yes, yeah. We'd like to hear all thoughts. Everyone,
I think it works really well for the epidemiological use cases where you're really trying to track outbreaks and monitor, the spread of the virus. But the second part of the question is, what about for phenotypes? And, I think also we need to be thinking about subspecies classification that also matches virus phenotypes. And I think Peter gave a nice example of that. I work on enteroviruses, and so I'm very familiar with that aspect of enteroviruses. And you have some that are in very different branches of the tree that have very similar, medical phenotypes that are important, when you're dealing with infected patients. So I think that's one thing it would be worthwhile having a discussion about is how do we have these different types of subspecies classification, some that are good for epidemiological use cases and others that are good for medical use cases.
Maybe, I imagine at this point, if there were to be a phenotype change in SARS-CoV-2, we would finally get that high designation from the World Health Organization. That's how I imagine it would play out. I mean, there would obviously be a Pango lineage, but it would have, an obscure letter dot number name. But if there were a phenotypic importance, I think the WHO or Twitter would step in and name it.
We have these convergent mutations that you see coming up in different lineages and things like that. And there's not a really good annotation system, I think, that captures that. You kind of have to do it manually. But, I think that would also be helpful.
I guess you could always map from the genotype to the phenotype, but the opposite is not possible because you have convergent or parallel evolution. So,
yes, go ahead.
Just on that note, if you have multiple arisings of the same phenotype again and again, because the lineage naming system, you have unlimited names. Each one of those could theoretically be a different lineage, if it was arising and then spreading onwards, in theory. But if it's not, if it's just something you see cropping up, and if it's not, say, epidemiologically relevant, Pango system probably wouldn't be the use case for that, and you probably just need a different descriptor for sure. Yeah.
So I have a question, regarding to what about viruses that a lot of viruses still heavily based on serological data? What's everyone here thought about the classification system? For example, dengue. Dengue is still serotype 1, 2, 3, 4. yeah, what's your thought and what everyone thought about that? Yes, go ahead.
So
Anya.
Just because I used to work with her, I know Verity Hill and Nathan Gruber's group have been working in conjunction with a lot of dengue experts over the last year or so to try and develop a system. And I don't think it's pre-printed yet, but I think they have come to some sort of Hango-like consensus for the dengue system. So apparently it was quite a challenging thing, again, similar to the RSV sort of efforts where they got people who, I suppose, dengue stakeholders in a panel or in a Zoom call together, and then kind of figured out what was most important. But I think from what I've heard, it hasn't been pre-printed yet, but they have come to some sort of consensus there, and there is going to be a nomenclature system published soon for that.
Rodney, and
can I ask a follow-up question to what you just said? So that's really interesting to me because dengue 1, 2, 3, and 4 are so genetically distinct. They're very easy to categorize. So I'm wondering what the use case for having some system below those designations is. What's pushing this?
The new vaccines. They're wanting to track how the virus evolves in response to the new vaccines as they're rolled out.
Leah.
Yeah, Leah. Oh, hi. Sorry. I'm Leah Katzelnick. I've mostly studied dengue, and I do know that they were working on their updated nomenclature, which the dengue field has desperately needed because we'd had genotypes that were labeled, I think, when Eddie Holmes circled, on a really early phylogenetic tree in 2002, and those were our genotype names, but they have been completely outdated and haven't been updated in 20 years. And there are two different nomenclatures. And there is a huge amount of genotypic variation within the serotypes, which has been linked to antigenic variation. And then there's also variation even within that. And the field has just sort of been a mess where we all use different names and have no kind of consistency, especially for some of the more smaller sublineages beneath genotypes. There's very little consensus on how we talk about any of that, and that's a huge amount of the interesting diversity is there. So.
Well, sorry, Betty. Sorry, she was.
I just wanted to make a comment about sort of the usefulness, I think, of the early naming because it gets people's attention. And I just love being part of the SAVE project because things are so swift. So the genotype, when it starts to really expand, is when it gets our attention, right? Everybody's attention. So in a pandemic situation, you see one new genotype taking off. And very early in that, you can get the viral sequence to both the in vivo and in vitro group in something like the SAVE program. So I remember Omicron just being astonishing. It was Thanksgiving week, that it was first discovered. And by Christmas, there were 3 groups, I think, with serological data showing its neutralization escape capabilities. And then soon after that, maybe a couple more months, they begin to get the in vivo studies where they look at animal models of transmissibility in lung, and we saw that it maybe was causing a slightly less severe disease, but total immune escape. So the genotype leads the phenotypic description, I think, and enables that to come really fast. So what the virologists in our SAVE group would say to us is, we don't mind some misses. If you get something that's really coming up in a lot of countries and it doesn't go anywhere, it peters out. That's all right. It's okay to invest some in misses, but it's also enabled really swift work characterizing the phenotype literally in the order of months. Literally.
So Betty, on that note, there's a question that we have. Actually, a lot of people were circulating before is that, like to have the name, then, this, and then to have response, like, like before the lineage name, is designated, something like that. What's your thought on how critical of that timing? Or literally, or because we look at the sequences without the name, but with the mutation. Yes, we look at the mutations and forms of spikes that are increasing. But that said, I can't talk about it with anybody else until I've got the name. And so communication is really facilitated by the name that everyone's seen on the tweets or heard or discussed. So I can look at
I use the sequence data from GIS8 to look at these transitions, but then I compare it, and then I can also compare to what y'all are doing with your trees and how you're seeing that things come up. So it gives us a common language, but I actually use the sequences myself. However, I think the names are really valuable for the communication. Literally.
Derek, I'm sorry, I'm gonna go in order. Just go ahead, Derek.
Yeah, thank you. I would like to follow up on what Richard said about the phenotype, and in particular to mention the antigenic phenotype. I think it's fantastic what Tango, Next Strain, Usher, all of that stuff. It works fantastically well, but it really is just for the genotype. And WHO are not going to say pi. And even if they do say pi, that's absolutely not at the level that we need for considering things like vaccine updates. And not only for considering vaccine updates, but for looking at what are the drivers of the evolution? Scientific investigations into the selection pressures and the constraints and epistatic interactions to, as many groups are now, trying to predict what's going to come next and what's going to be significant in terms of antigenic escape, and when might a vaccine need to be updated, and what about a bivalent or a trivalent or an even more multivalent vaccine? And this whole area of research is it rests on the foundation of the genetic information, but the primary phenotypic output is the antigenic information. And the antigenic information is noisy. It's only on a small subset of everything that is sequenced. In SARS-2, it's really on a small subset. In flu, it's on about 10,000 strains a year. And it used to be, before sequencing became as cheap and fast as it is, it used to be an antigenic phenotype first, and then sequencing just some of that. Today, it's the other way around. It's sequencing. It's only really been the last smallish number of years. It's sequencing first, and then, okay, when there are amino acid differences, choose a handful of representatives and do the antigenic phenotype. And for meetings like at the WHO vaccine strain selection meetings for choosing the vaccine strain, that's predominantly antigenic based in terms of the key things. Of course, everybody's looking at the genetics. You want to know the lineages. You want to know what's involved, but our immune system sees the antigenic phenotype. And having this really well hooked up with the fantastic work that has gone forward in leaps and bounds over the last small number of years with the genetic analysis, I think would really make a difference. And whether that means incorporating some antigenic information into the names, as I mentioned briefly in my talk, maybe when there's an antigenic change from what's come before, maybe an underscore instead of a dot. Your name. Or, there's this other naming sequence that we did in flu where we alternated between a numeral and a letter for each next level. So it wasn't, X.Y.Z. It was, A to B. And we did that so we didn't have to have the dot. And then we could use a dot to mean and to mean antigenic change as well. And, that isn't going to solve it for pathogens. It isn't going to solve it so well for H5 in the example that I gave this morning, where some of the clades are intertwined. But it is it would cover most cases when looking at, the pathogens that are continuing to escape the same immunity globally, like flu does and like SARS-2 does. And that's one aspect of the antigenic phenotype, the basic differences. The second difference is, well, what about people who've been exposed multiple times? Because then we have this complex prior immunity, and how are we going to record that, right? And one could take, in an extreme case, one could take all, did you say it was 13 million now? 16 million? You could take all 16 million You could have them all in one antigenic map.
Literally.
If people had done antigenic data on them all. Or some other representation of the antigenic phenotype. And then plot also the population immunity for people who've been multiply exposed on that too. A visualization like that. This is the holy grail for thinking about vaccine strain selection, for example, which is really what all of flu surveillance is for. I mean, yes, it's for some other things as well, but that's the primary thing. And I think it will be probably the primary thing that SARS-2 surveillance is going to happen in the future. And integrated into that, various methods to predict what might come next. And for me, this is the holy grail. And of course, it would be on a subset. It wouldn't be on all 16 million. You do it on a tiny subset. And to choose the representatives of what to phenotype, which is what happens in flu. That's how currently those approximately 10,000 a year are done.
Well, thank you so much, Derek. That's really, really insightful. Anya, thanks for waiting. And then I'll go in order. Yeah.
So my original comment was different, but I'm going to respond to this. So we have already changed the criteria for the average criteria, what we use to describe a pango lineage. So like I said in my talk in 2020, we were primarily using metadata like geography and travel history. And then when the priorities shifted towards flagging variants and the genotype, that is what became the primary criterion for flagging a new lineage.
Literally.
Now that the pandemic has continued and we still see evolution, it seems only natural that there's a shift towards being concerned with antigenic phenotype. And there's no reason why that couldn't be incorporated as one of the primary ways of flagging a new lineage as evidence of some sort of antigenic shift. And I think that is probably a way to keep the system relevant and useful for SARS-CoV-2 going forward. I don't think in the way that when we previously designated lineages based on geography and then shifted to SNPs, we didn't need to change it from a dot to an underscore or anything like that. We could just change it and it's fine. And because we're in the field, we're keeping up with this and we're aware. And I think the nomenclature remains the sort of elegant system that we have, and it's not causing any more confusion by introducing different special characters into it. That's all.
I have just a quick comeback, if I may. I realize there are other questions, but just to say, I think that won't work because there's a lot more interesting genetic variation than there is antigenic variation. There may be, in flu, and I'm pretty sure that it's the case in SARS-2 as well, for one basic antigenic phenotype, and even very similar variants antigenically as far as our immune system concerned. So antigenic variation that doesn't matter functionally. There may be 3 or 4 or 5 or 10 different genetic lineages and multiple fixed amino acid substitutions that are not of significant antigenic change. So there will and there needs to be, I would say, a genetic, multiple genetic pango lineages below the level of, okay, now we've got some antigenic change of significant.
Okay, yes, Richard and then Richard. Okay.
Yeah, so this is Richard here. I also had something to follow up on Derek and Anya. So, to my mind, the usefulness of genetic characterization is precisely because it is such a high-dimensional phenotype, right? So if you have an asexual organism, the tree sort of hierarchically splits diversity, and that's effectively a more or less infinite dimensional space. So why cartography is useful, because it seems to map it into a low-dimensional phenotype, and that's where you happen to see, where sort of recurrence and sort of convergence is a thing, right? It's very hard to have convergence in high dimensions because everybody runs off in a different direction. So I think there's really no way around sort of basing something, the underlying classification on genetics. We used to use serology because we didn't have anything else. But, we have genetics, it's unambiguous, and, that's just what it is, at least, in absence of recombination, right? And if there then ends up being convergence, I think one probably needs some sort of if there is convergence, putting a dot or underscore doesn't really sort of solve the problem, right? Because it's different parts of the tree. So I think one probably needs some different level. And I'm also a little skeptical that it'd be practical to use something like ferret serology or hamster serology or whatever they want to use for SARS, because it's not clear that this is actually it often is the phenotype we care about. But for the H1 pandemics, for example, for many years, the ferrets didn't really see much phenotypes.
But I think there was just one miss. There was only one major miss, and that was in a population of about a decade of age. I'm not saying it's...
For many years, we had 156 and no other mutation, and the H1s that sort of seemed to matter, right?
But most of the time not. I mean, you can't come up with 10 examples of that, I think, or even 3 or 4. Yeah, there is the occasional one that's important, though. I agree, Richard.
So I'm just... I'm sort of a little skeptical that it'll be practical to sort of try to, smush these different levels together too much.
Thank you so much, Richard Nair. I'll go to Richard Schumann next, and I'll circle back.
So there's this underlying premise that subspecies classification has to be a directed acyclic graph. But I think Tavis made the point that don't we think of this as a multidimensional problem? And why can't we classify subspecies based both on genotype and phenotype? Like, there's no reason why we can't do something like that. And I think then that solves the problem, right? So maybe we need to change the way we're thinking about the problem.
Thank you, Richard. Okay, Aneta. Yeah. And then we'll go back to Betty.
So when I'm at work, one of the things that I do very, very frequently is we want to design a new feature, a new something, a new tool. And we consult with people who we imagine are going to use the tool. And we try to define what the use cases are. In other words, we try to say, what are the problems that we are going to be trying to solve with this tool? And I think one of the things that has popped up several times in the conversations here there are several different use cases for subspecies classification. I thought Philippe had actually a really nice slide in his presentation where he talked about the different things that could be categorized through the classification. And I agree. I think that this can be something that is multi-layered, where in this workshop, if we can come up with a list of what the use cases are and what the type of classification that satisfies those use cases are, then we're on the road to having an actual solution for future things, right? We're probably not going to redesign classification for flu. We're probably not going to redesign classification for HIV. We're looking forward to try to apply what we have learned from these other experiments and do something better in the future.
Thank you. That's really, good thought. Betty?
I just wanted to bring up 2 little points. One is, the idea that people can construct a name for their use. And so you have large metadata tables, and then you say, what fields do you want in your name? So your subset of viruses that you pull down have the associated data, and it doesn't have to be an underscore period. It could actually be a little bit longer and more intuitive. So I think that's really, really useful for users. The other thing I wanted to bring up is just the serotypes are so complicated that it adds an extra layer. And one of the real controversies in SARS-CoV-2 or confusions, I guess, is that the group in China that's so quick to respond with neutralization data often has opposite results with their serological data than the groups in the US. And is it that the Chinese are wrong, or is it that they have a different immunological history, which I think is quite likely? They had very different, SARS-CoV-2s in their population. They got a different vaccine. If they got different vaccine histories and epidemiological histories in the 2 countries, which might be driving it. So then how do you capture that complication? And you did it by having simpler single infections, but it's maybe going to be tricky.
Oh, Betty, I completely agree. You have to capture all of that. It's just the first thing to do is to get the basic antigenic differences and then to layer the complexity on top of that with the antibody landscapes in an additional dimension, I think.
Ryan, Conrad?
I don't know how useful this will be, but I'm a fan of thinking and explaining things via like analogy metaphor. And numerous times we've talked about, particularly in the case of pangolin, as it being sort of like an address, a location, whatever on the tree. When you're talking about actual physical addresses, locations in the US, there's also zoning that it goes along with them. And to me, it seems rather natural to think about you have your address coordinate space on the tree, and you can zone it with regards to what type of antigenic specificity or difference, whatever you have. And I mean, it would be, you have to work out that sort of zoning system, like what types of zones do you have? And it's a whole nother classification to work out. And you need to have, ideally in my head, some sort of system to map between, if you're this genetic thing, do we know what zone you're assigned to? But I don't know, to me that, at least in the analogy space, it seems like a nice way to think about it.
Go to sorry, I'm going to pause a little bit. It's online question. Is it okay we come back? Is there any? Okay, I'll be right there, Derek. Here, Anya, go ahead.
I guess it's a kind of clarification of my previous point, but linked to the usage of an antigenic shift. I wasn't necessarily suggesting to abandon the genetic information, because you're still trying to codify the tree in some way, but an antigenic shift or evidence of that could prompt the description of a new lineage. So even if such an antigenic property is coming up multiple times, yes, you'll have 10, 20 lineages, but they'll have different names, but presumably then the sort of descriptor of why that lineage was designated will be the antigenic shift. So
would you like to? Okay. Yeah. Okay.
Yes, I would like to say something that's a little bit related to what was said here, and something that Justin just reminded me of, which is that the density of the sequencing in SARS-2, and I think with a little bit more work on the antigenic side in terms of setting up pipelines for which variants are tested, and the system is absolutely maturing into that. I think that based on a particular sequence, one can do a pretty good guess of where the virus sits in antigenic space. Because, okay, not every variant will be tested, but many will be tested. So one could actually have, for some small subset of the X million sequences, okay, this has been tested antigenically and it's approximately here in antigenic space. And based on the work of that sort of testing and the sort of work that David Ho's laboratory has done, and some others, of figuring out what is the, testing individual substitutions, and the DMS type work as well from various laboratories that says the effect of substitutions, one can actually get an estimate of the antigenic phenotype for all the other sequences. So that could be a way that this stuff could be added in. And I also really like what you said, Betty, about getting the level of detail. You could specify what level of detail you want your name to come back as. I think that would be great.
Okay, thank you, Derek. I think Cornel, and then Rachel. Yeah.
I mean, nothing stops us from having that alternative mapping from antigenic space to some naming system. You could just, I don't know how you would name it, but it sounds like when you always present these maps in 2D space, you could just have a grid and it's A to Z and 1 to 10. And then you could just talk about your location as M5. And it wouldn't replace the genetic classification.
No, it's based on the genetic classification. I mean, as Richard said, I mean, yeah, the sequence is what's being folded and then what the antibodies see. And yeah, whether we do it by absolute grid position like that, or X or Y distance, or radial and circumferential distance from Wu1, or from 2 or 3 different reference points, something like that.
But the problem there is you wouldn't be able to get that from the sequences read.
Well, but you can estimate it from
right. You can estimate it, yeah, but
it's much better than having nothing.
True, yeah,
because I think the estimates will be pretty good.
But nothing stops you from developing such a nomenclature.
I don't think anything does now.
Yeah. Ratio,
no.
Yeah.
It's listening. I don't think. I mean, so it's 2 things, right? It's the mapping from genotype to the phenotype, which. Yeah, I mean, as I say, it's been worked out. I think we could estimate that, or that can be estimated from the work that's been done, and then having a nomenclature for it, and then getting it in the records.
Well, ratio. It feels like we're edging towards the point I wanted to the question I had anyway, which is why we don't need the phenotypic classification scheme to be phylogenetic, as far as I can tell. Is there a reason to make it phylogenetic? It sounds like phylogenetic classification is not the right thing for a phenotypic thing. So explicitly be clear that sounds like we need a non-phylogenetic classification system. Thanks, Ronnie.
So unfortunately, Don's not here, but I want to remind everybody that the human adenovirus scheme is basically what's being proposed here. It focuses on 3 genes that together form the exterior of the capsid that are involved in tropism as well as immune response. And so when you think about this sort of away from adenovirus, this kind of approach where you understand the diversity across a whole genome, what's being done with trees now, versus looking at specific coordinate space along that genome and saying, we're going to score this additionally as a separate entity, not only solves the problem about moving from phenotype to genotype or genotype to phenotype, but also solves the problem for reassortment and recombination. Because then you begin to look at genomes as blocks of information, and you can score those blocks separately based on whatever criteria you have for scoring those blocks. HIV is hard to do this way, so don't give me any HIV examples. But for a variety of viruses, you can approach it this way. And in one block, in this case, a very important block would be the block involved in the immune response.
Yes, thanks, Ronnie. Okay, so Indrich first, is that okay? And then followed by Richard Schumann.
So going back to the naming problem, that's where we started. So keep changing the name creates a lot of rift and issues. Why not, as we discover new information about the strain, why not label these? Because you can add new labels as needed. And then whenever you're doing analysis, you can pull down the labels relevant for your use case rather than keep renaming the classification that was assigned initially.
Well, I don't think we talking about renaming, right? I just want to make sure. Yeah, I think we just looking at limitation. How can we use the current subspecies classification and be able to link? Is there any limitation? I think, but what your point mentioned is definitely critical. We should not be renaming. Yeah. Thank you. Yeah.
Also, we're talking about recoding a lot of information in the name itself, and we are forcing ourselves to come up with the approach to recode everything. Better approach will be have a name and assign the new labels based on the new information that we are gathering from these antigenic or genotype or the phenotype as we discover it.
You have good point. Thank you. Richard Schumann?
Yeah, just one additional comment. So antigenic characteristics are obviously really important to try to capture that information, but also just evidence of positive selection, because there's this other subset of selective pressures that we don't really have a good handle on. And obviously it's important. So that's another kind of characteristic that I think we should think about, in terms of subspecies classification.
Go ahead, Rodney.
He sighed when you said that. To be fair, it's they're causing all the problems, not me. We're just having to sit in the same place. This goes back, your comment, I think goes back to this idea that I think it's sort of modern information and how we deal with it. We have dynamic information. We're adding attributes to entities all the time. We have to get over the idea of putting all that into a name that's stable. We have to move on to a world that handles dynamic information, which is a world of centralized databases where all these attributes are stored. And the keys are those genotypes, right? Or those accessions that are associated with a particular sample. And then using that key, you can utilize all the information stored in the data structure. And I think that's where bringing the community together really, really is hard, because I think as Derek was sort of imagining, all these pieces need to come together in fields that are not COVID, where there's been all this pressure for every scientist in the world to work on this, right? These other fields have to be able to do this too. And that information sharing is actually a big impediment. And so part of this, I think, is identifying stakeholders, as Neda said, identifying the information they need, using the computational techniques that already exist to serve up that information, but then to bring the communities together of bench scientists, of physicians, of genomics specialists, et cetera, in a way that the information sharing happens. So you have data structures that have all these attributes associated with the tags that are, provided by, public repositories or provided by the genomics.
Thanks.
Yeah, I agree. I think it's the subspecies label should just be relatively simple, and then you can map from that thing. You can map to other things. You shouldn't try to put too much information in, because it makes it too complicated.
So basically, it would be attributes that associated with the genotype information.
Yeah, serology, whatever is important to people.
Yeah.
There's many dimensions to this problem. Reassortment can be really important to some folks.
Yeah, you're right. This is hard to write and do this. Yeah. So I don't know, Betty.
Just a quick comment. We already have integrated neutralization data and sequence data at the HIV database. So we have an immunology database that has a tool called CatNap, and it turns out to be pretty complicated to use it, but because there will be 17 different studies with serological information, and we actually put in all of them and average them. You're able to get the sequences, you're able to get the data for the neutralization. And it's one of our most heavily used tools at the database. Actually, people love it. We've kind of got a CatNap version for SARS-CoV-2 as well that doesn't get used much, but the HIV one is used really heavily. It tries to bring immunology and sequence together.
Yeah, those resources really impacted right on our thinking when we're responding to SARS. For example, we use an explicit method of scoring mutations. So in our data structure, we're actually scoring the mutations present on each individual sample, because we're talking about SRA data. So our approach was to try to correlate that information where there might be noise, where you might have 3 or 4 residues that are really important for a monoclonal antibody or for vaccine to work, or vaccine efficacy, but then a whole bunch of other mutations that might actually cloud the picture, because they're going to tell you on a tree that this is distinct from this other entity when the serotypes are essentially the same. I'm not sure that's needed right now, but that was exactly the way we were thinking about it. But, in HIV, and there's another database, and I can't remember who's the one that hosts in California, Stanford?
Oh, that's the...
Yeah, and there's a drug resistance database also.
That's incredibly valuable to the field. Bob Schaefer leads that and has for 20 years, and everybody uses that. The physicians use it, and he takes into account sequence information and links it to drug resistance. So we used to do that at HIV, but Bob did it so much better. We just left it off to him. But we do have immunology links to the sequences throughout. Also, T-cell escape. We have that really embedded.
Anya?
So Anya till University of Edinburgh kind of stopped doing that. I guess it's a comment that links back to when we were talking about say the implementation of a similar sort of scheme for dengue virus and extending beyond SARS-CoV-2 as well. The name itself, obviously, a name is important, and it's a kind of a simple system that doesn't try to encode anything in particular, like the Pango system, other than representing the hierarchy of the tree. I think it can obviously be very useful, but proposing that naming system and what the actual name is not necessarily the difficult part. It's if you're trying to implement something for dengue virus or for, anecdotally, there's been a lot of interest from other arbovirus, the community for other arboviruses as well. The difficulty is going to be trying to keep that an updated, relevant scheme as more data tends to come in. And so far, it doesn't really seem like there's a kind of body of people that are there as an updating mechanism for it.
So updating, maintaining is more limitation.
The maintenance is where the actual work lies to keep a scheme relevant.
Thank you, Anya. Ryan?
I missed your name.
Leah.
Leah? I'm sort of shifting the topic a little bit here, but in the dengue field, I was curious what prompted the sort of your comment into we really need like a more unified like nomenclature, subspecific nomenclature system. Because I'm wondering, I don't know, maybe this is a thing I'm just particularly fixated on, but like at what point is developing or implementing such a system actually useful? Like, was it a growth in the amount of sequencing done? Was it a growth, not necessarily sequence, but just knowledge of the biology, or like what? Because at some point, just drawing circles on a tree is fine. That's good enough. But like, where did you go from that being good enough to it not?
So I'm not directly involved in the new nomenclature development. I've talked with Nathan and the CDC, who I know is working on that. I think a lot of it, dengue has so much bias just in terms of how the studies have been done over a very long period of time. So you have some places where you have 1,000 sequences or thousands of sequences, like in Thailand, and you have other places where they have, one sequence from like 2007, and so just, which I think, that's also a problem for COVID, for SARS-CoV-2, but it is still have a lot more information on individual places. And so you've been dealing with it, but dengue is going to be magnified over time. Why do we need a better nomenclature? I think because we don't even know as a field kind of how to talk about the sequences. So there's a lot of information that's lost because we aren't even able to really communicate about what the genotypes are. There's genotypes that are incredibly ancient. There's one representative, and others that are probably 4 genotypes. Based on kind of modern genetic diversity, but we're still using genotype names that are from 20 years ago. And so even just for talking about, lineage expansion and epidemic outbreaks and kind of a lot of the biology and science, I think is hindered because we haven't had a consistent way of talking about this. So there was a lot of interest probably 10 years ago in lineage replacement and understanding it, but kind of people were talking about lineage replacements even at really just different scales, right? Like very micro lineage replacements versus larger genotype replacements. All of those are kind of talked about in the same way. So the field would basically benefit by having a more shared nomenclature, dealing with some of these biases in sequencing over time and across space to be able to do better science. And then also, as more places are able to be doing sequencing, have it be relevant to local epidemiological decision makers to use the sequences for actually controlling dengue better.
We have 3 minutes left. Anyone that haven't shared your thought? Anything left behind? Elliot? Yeah, go ahead.
Sorry. So what I wanted to do is kind of give a concluding remark to follow us into tomorrow. And the way the discussion has been going, I think has been ideal in terms of our final day, because we've really come to focus a lot now on use cases and why are we doing all of this? And people have been coming from that perspective in any number of different ways. And so tomorrow we're really, that's what the focus is tomorrow, on use cases of specific use cases arising from the research community, but certainly from the public health community. And, when thinking about how to organize the workshop as a whole, we could have put those use cases up front and done them first, and then we would answer those constituencies as to how we best will address their use cases. But I think there's this kind of an interesting way to do it, because now we're telling the people who have the need, we're telling the stakeholders, we got all of this stuff. Now come help us understand how you would like us to organize this stuff and provide it to you in a way that'll make a difference. And so I'm really looking forward to tomorrow now to help us further coalesce all of these discussions. And as a reminder, it starts at 9 o'clock, 30 minutes earlier than we have in the past 2 days.
Well, thank you so much, Elliot, for concluding and sum up, and we can leave 2 minutes earlier. Unless anyone else have any questions or comments.
And so I'm online question. What about naming system differentiating WGS and partial sequencing? I hear a lot of groups. And so I'm partial because not wanting the useless data. Curious about thoughts on this.
Okay, anyone want to hop on that?
And so I'm
complete versus partial sequence data.
Anyone can do partial sequences and just have it. I mean, the nomenclature can be whole genome based, and then you just do partial sequencing and get your result based off that.
And so
it's not necessarily a contradiction.
And so I'm.
Thank you so much, Cornel. I think we good. Thank you so much, everyone, for staying this late. Thank you.
And so